Curiosity is one of the gifts and superpowers for you to become a better communicator and really connect with other people on a deeper, more close and intimate level. Now, as a child, we are all very curious and we ask a ton of questions to learn more about others and the world. But somehow, the older we get, it is something that unfortunately diminishes over a period of time. Now, in this video, I'm actually going to cover why curiosity is an absolute asset when it comes to communicating and connecting with your patients, and how it can make a real difference to your interactions and connections with them. Back to my channel, everybody. It's always a lovely thing to see all of you tune in and check out this content and engage with it, and for all the support and visibility that I have received over the last couple of years that I've been doing this. My name is Shweta. I'm the founder of Healthy Dynamics. We are a coaching practice that helps English as a second language healthcare professionals become more empathetic, effective, impactful, collaborative communicators to build trust, influence, and authority with your patients. So if you're someone who works in healthcare in a clinical role, who's in a patient-centered role where you're working with patients all the time, and you're figuring out ways in which you can improve your communication with them in a way that helps them connect with you better, and you can get better feedback and better reviews and better ratings from them, you absolutely come to the right place. So like I mentioned in the very beginning of the video, we're going to be looking at the concept of curiosity today. So curiosity is something that I was gifted with as a child, and not only did I ask a lot of questions, and I learned through observation and did as much as possible to really get to the heart of different matters and different issues. Because if you know anything about me, I questioned a lot of things about the way the world is set up and the way that the world works, and I was very much against a lot of things. So being naturally curious and observant really helped with that, and that fortunately has not changed the older that I have gotten. Unfortunately though, the older we get, somehow it's really frowned upon to be curious about not just others, but also different things. You're just sort of asked to believe and take at face value whatever the information that you're supplied with. But I'm very pleased and glad to see that this is actually making a comeback now in industries and in the space of communication and in different fields of work. My colleague Julie Pham, actually her consulting business is actually called Curiosity Based. I'm just going to leave the link of that over here. You can check her out on LinkedIn. Her organization does amazing work in cultivating the concept of curiosity in organizations for them to become better communicators and leaders. Which reminds me, I think I should definitely have her on the YouTube channel and interview her at some stage, so stay tuned for that. So in this video, I really wanted to touch on some of the benefits of being curious and demonstrating curiosity and cultivating it and practicing it. Before I do that, let's imagine a scenario when you are going to a social event, or you're going to a party or something like that. You're meeting somebody, you're meeting a bunch of new people, and they just ask you very superficial, surface level questions. They tend to be things like, what do you do for work? Where do you live? Where are you from? And things like that. Whereas in that situation, when you ask somebody, a much more in-depth question where you can really get to know a person on a better, more deeper and closer level, that the other person really feels like they belong here. So they don't have this awkwardness of, oh, I'm having to make small talk and be around people who don't know me very well. It's a very good thing. They feel like, oh, someone's actually putting the effort to get to know me on beyond just the surface level and beyond just the accolades and just the superficial factors. And that really is the power of curiosity and the difference it can really make in terms of how you can actually connect with others on a deeper level. Now, one thing I have to let you know is that there is a big difference between being curious and being intrusive. This is something that I will cover in a future video, so stay tuned for that. But the bottom line is, it's very good to be curious, but it should never cross the point of it becoming intrusive, where you're asking questions that are inappropriate or making the other person, in this case your patient, uncomfortable. And in that process, you are, really, it defeats the purpose of what you actually started off with to begin with. So when it comes to curiosity, there's a little formula that I have come up with. So it looks a little bit like this. So the more curious you are, you connect better, in this case with your patients, there's more trust, and ultimately it leads to a better outcome. So it's like a formula where curiosity is the end result and you add all of them up together, and these are the little ingredients that make it all up. Now, let's get into some of the reasons why curiosity towards patients really, really matters. Number one is that when you're in consultation, you are doing beyond just the bare minimum of following protocols, ticking boxes, and you're viewing them more than just a number in the system and a diagnosis. What you're actually doing is you are honoring their stories, their needs and concerns. You're making the experience a lot more personalized for them. So you are actually diving deep into what makes them the individual that they are, and or their challenges that are as unique as they may be. So it really gives that better insight, a more in-depth insight into what your patients are like and what their challenges are and why they operate the way that they do. So that again is a very big, huge advantage of showing curiosity. One example that I can think of is my own therapist. So obviously when I started working with her, in the very first session, she had to, even though she was given a bit of a background story about my challenges with mental health, over time, I really saw that she was being more and more curious towards asking me questions about my childhood, my relationship with my parents, and their expectations of me. And not only did those questions help me build that trust with her, but I also got the feeling that she wanted to really deliver her therapy to me in a much more personalized way, and she did not just see me as this one person for whom you treat every single therapy client of yours the exact same way. So she saw that uniqueness in me, and she also got to know me on a much better level than just any other immigrant child people that she normally does her therapy sessions with. So again, making that whole experience much more personalized made me connect better with her and trust her a lot better. And it is something that if you are, say, a therapist in the mental health space, you should absolutely try this. So obviously once you've crossed the main questions of what the patient is experiencing in terms of challenges, dive into much deeper, more insightful questions that gives you a better, more clearer picture of what the patient is looking for. Number two is that it demonstrates genuine care towards patients. So when you are actually demonstrating curiosity, you are asking thoughtful, in-depth and insightful questions, and you are listening. So this again is very similar to the small talk analogy that I just mentioned. So you are actually demonstrating that you understand where the patient is coming from. Again, shows relates very well to empathy, which I talk about a lot, and as well as active listening. So what this really does is that when you are demonstrating genuine care and concern for your patient, and you are showing that commitment that you are willing to, you're doing whatever you can to get them to a better place in their health, it will help you understand what it feels like. So you're putting yourself in their shoes, and the relationship becomes much more collaborative rather than authoritative. And that really invites the patient to be a partner in the space of achieving better outcomes, rather than just someone who's just receiving the doctor's diagnosis, advice, and consultation. So it just changes the whole dynamic of how your relationship and equation is really built. Number three, definitely I would say, is that the factor of authenticity, transparency, and openness is really enhanced when you are demonstrating curiosity. So when you get to know a patient on a much more a more human level, let's just put it that way. So a much more human level, when you are asking questions not only about their childhood, but also just who they are as an individual, what lights them up, what interests them, what do they like to do on their free time, what is it that makes them happy, what brings them joy in their life. And all of this can be a very good way that you can actually condense it into their treatment plan eventually. So when you are doing it, you're making it a much more customized and personalized experience overall. So, and you're doing it from a much more genuine place. Now, I have to remind you that when you are demonstrating curiosity, make sure that you're not asking questions that may trigger patients, that may make them feel uncomfortable, or it causes them to shut down. There is a post on LinkedIn that I made quite recently, which I'm going to link over here, where I made this mistake. So, being a naturally curious person, and I'm also someone that people always come to, for my friends and family, they come to me for advice and solutions and all that. I take pride in the fact that I'm quite a good problem solver. However, to get to the heart of the problem, I let people vent, but I make that mistake of sometimes, getting into the, fixing mode or trying to solve the problem for them, in which makes me ask them questions that can be quite intrusive and can come across as quite nosy, even though that's not my intention. And it has actually caused people to really disengage from me in the past. So whilst it's a very good thing that you are showing that commitment and are attempting to get to the person who's coming to you to a better place, it's very important that you do not cross that line and don't ask them questions that are going to really set them off in a different direction, or reveal any ulterior motives or wrong intentions you may or may not have. So these are just some of the things that you can do in order to demonstrate what curiosity is, and how you can actually use that as a very valuable tool in order to connect better with your patients. So I will also make another video in the future based on that LinkedIn post that I just made, about how you should have that clear line of division between what being curious is and what being intrusive, nosy, and crossing the line and becoming quite personal it is. So that's a different video for in the future, so stay tuned for that. So to check that out, be updated with that, and for the rest of my videos, make sure that you hit the subscribe button, the notification bell, leave this video a like if you like it, and as always, thank you very much for your time, attention, and presence, and I'll see you next week.